Hi everyone. Just as a reminder, you're now in the breakout room for Global Networks featuring AfriHealth and the National Academies of Sciences, Engineering, and Medicine. And a question is Georgina here from AfriHealth, or is there a presenter from AfriHealth that will be with us in this room?
Yes, it's me, Esther.
Esther. Okay, great. Thank you. And I see Daniel, you're here. Can you hear me well?
Yes, I do. Thank you.
Okay, great.
And you? Am I audible?
Yes, you're very clear. So for those of you who are just joining the program, the way today's session will work, it's meant to be very informal. We will have two presentations, one from Aster from AfriHealth and one from Daniel from the National Academies. And then we'll have some time at the end for informal questions and discussion from the group. So with that, we've asked each presenter to speak for about 8 minutes. With that, I'll hand the floor over to Aster. Please tell us a little bit about AfriHealth, and your interest and availability to partner with different institutions across Africa. Aster, I'll give you the floor. You're welcome to share your slides if you like.
Okay, thank you, Amit. I will. Can you see my slide?
It is loading. Yes, I do see it. It's not yet in presentation mode. Yes, we can see it. Please go ahead.
Okay, thank you, Amit. I thank all the organizers for arranging this forum for networking. And I am Aster Zagaye from Addis Ababa University, Department of Medical Laboratory Sciences. And I'm a member of AfriHealth, which is a Pan-African organization, the African Forum for Research and Education in Health. And the office is in Kumasi, Ghana. So AfriHealth, as I said, is a Pan-African institution which was established in 2016, which is composed of health professionals of diverse specialty like physicians, nurses, laboratorians, pharmacists, all health workforce cadre. And we are members are with diverse experience in the health system in their respective countries. And AfriHealth works to achieve excellence in health profession education, research, and ultimately through quality education and research to influence the healthcare service in Africa. It also serves as a leader and convener for scaling up South-South networking and collaboration across the continent so as to address, the daunting health workforce challenge throughout the continent through an interprofessional education as well as research. And maybe I don't know how many of you know about AfriHealth. Initially, it was created as a PEPFAR-funded project for medical education partnership initiative, considering the shortage workforce in the continent for physicians as well as nurses. There used to be MEPI-NEPI. And then MEPI-NEPI, after, making sure intervention was made for medical education as well as nursing education. Finally, there was an understanding just by enhancing the capacity of physicians and nurses, you cannot tackle the health problem in Africa. So it becomes, an organization with a diverse health workforce cadre. And when we see AfriHealth, we are almost represented in most parts of Africa, except the North Africa. And recently, whenever we get opportunity to network, collaborate, we are trying to get more members from the northern part of our region. And as I said earlier, members are diverse health professionals. We also have researchers from basic to implementation science. And the partners are mainly universities, research institutes, policymakers, international as well as global institutions. And some of the activities, mainly we were engaged in research during the COVID era, COVID in pregnant women, in pediatric population, the impact of COVID. And then we do have a continental-wide research, which involves 12 member states on vaccine effectiveness. We also have research on COVID-19 and sickle cell disease in some part of Africa, as well as research on health education. And we do have like capacity building trainings for leadership, grant writings, learning management. And also we do have several learning platforms. And regarding data generation, utilization, recently, the project I mentioned, we do have a large-scale project in 12 member states, except the North Africa, from 3 from each of East, West, Center, and Southern part of Africa, on COVID vaccine effectiveness, and also to see the bearers and enhancers of COVID vaccination in the African health workforce, as well as to see the impact of COVID on the health system of Africa. So we try to utilize national data system in these member states, and this was an excellent opportunity for us to make use of the huge data that exists in the continent, as well as to see the gap, how rich these data are, how capacitated we are in terms of utilizing data, and also to look for the gap in utilizing data. As I said, we do have this data generated, and this project is supported by the Africa CDC Mastercard Foundation in collaboration with IDI from Makerere University, as well as AfriHealth, my institution, in collaboration of national public health institutions in the respective countries. So we closely work with Ministry of Health and the respective national public health institutes. And as far as utilization, we have like closely 12 publications are on pipeline as part of strengthening our own local journal of public health in Africa. We are preparing like 12 manuscripts as special issue, policy briefs are being prepared. So we took this and as an exercise, even if we know COVID is now getting down, but we are, having this experience to tackle any future pandemic that could arise in the continent or globally. So we also do capacity building trainings, sorry for the typo here, on data science to empower African scientists to make use of the large volume of data generated in the continent. We know data science is useful to change the healthcare service in our region, but we see there is huge gap, and we have to really work on capacitating our African scientists on data science, because we know now data is fuel. And through this networking experience, we were just trying to address the 3 bulleted points that were shared by the organizers. And we said, we can have networking with diverse expertise. We do have this wide base of researchers, academicians in our organization. And we can also partner with researchers and also other networks in this organized platform. We can do like collaborative research. We already have such experience of collaboration within the African continent, especially after COVID. We are having this South-South collaboration, which is, I would say, very strong, especially with our last project Proof. And also, we also to collaborate for capacity building on data science. We know Africa is a young population. Africa has young scientists, and we also have, large pool of data of, infectious, non-infectious diseases related data. So, we have to capacitate our own scientists in utilizing of those data for to improve the quality of health service in our continent. And I'm really sorry. Yeah, I'm sorry. Yeah, can you see it, please?
Yes, yes.
So, I don't know, since I am on the slideshows, yeah, I see like 27 participants here. You are all invited for our symposium, which we always take it as a platform for networking, not only South-South in our symposiums, which we have it like in a rotation basis in the member countries, in the member institutions. There is a good opportunity for networking, exchange of sharing ideas. So our future symposium will be in Nairobi in August, from August 6 to 8. You are invited, and you are, thank you so much. Asante. Masaganalo in Amharic, Ethiopia.
Thank you so much, Aster. Thank you for the great presentation. Really great to learn about AfriHealth, and thank you for adding the information for the participants of how they can partner with you. We're going to ask everyone to hold your questions until after the presentation, after the next presentation. But in the meantime, you're welcome to use the chat to start asking questions and bringing them up for discussion later. But at this time, I'd like to introduce Daniel Placht from the National Academies of Science, Engineering, and Math. Daniel's going to present to us some of the work that the National Academies are doing that's relevant to African scientists. With that, I'll hand the floor over to you, Daniel. Thank you.
Great. Thanks, Amit. Hello, everyone. As Amit said, I'm Daniel. I'm a program officer at the U.S. National Academies of Science, Engineering, and Medicine. And today I will talk about our U.S. Frontiers program. Before I do that, just a quick overview of who the National Academies are. We were established about 150 years ago to provide expert advice to the government. We are very close with the government, but we are independent, and that allows us to advocate for the advancement of science across the nation as well as the world, and the use of data-driven decision-making. We do this through a number of mechanisms. Our main one is consensus reports, which bring in all stakeholders on a particular topic to discuss and come to a consensus about what the facts are. And that is then presented to Congress or other sectors of the US government to build policy off of. We also have a membership organization. If you are a member, it is a very high career distinction. Usually the members of the National Academy of Sciences have made significant contributions to their field. They have numerous patents, publications. They have really driven change and understanding within that field. Please don't ask me for details about any of this because I work on none of that. What I work on are the international programs, namely building networks and collaborations between US researchers and colleagues around the world. That is where this US Africa Frontiers program comes in. It is based on a long-standing Kavli Frontiers of Science, which has been running for about 3 decades. The US Africa Frontiers is a relatively new program. It started in 2022, but with the understanding that we needed a shift in the paradigm. No longer, like, the US has great researchers, it has a great research ecosystem, but it would be foolish to assume that it has all the answers. And we do not have a monopoly on talent or capacity. So this program is really geared towards that paradigm shift of truly partnering with colleagues in Africa and other regions of the world to see what they are working on, what their approach to problems are. So what this program does is it essentially convenes about 100 early mid-career researchers who are at the front of their field, that are exploring the frontiers of their particular discipline, but also understand that to truly solve some of these issues that we are facing in the US, in Africa, around the world, we truly need an international and interdisciplinary approach. So we specifically build that into our programming. Each symposium is structured around 5 plenary sessions that are distinct, but there are areas of overlap because there are numerous conferences. You've all been to conferences where, you know, everyone is an expert in that field, but everyone also has been trained in that field to approach problems in a similar way. They have similar viewpoints, and it's really crucial to break down those silos and bring in other perspectives, which is what this program does. One example that I like to use, and I use all the time because it's great, is we have a similar program with the Middle East. And for one of our events, we had a session on petroleum. The US likes petroleum, everyone likes petroleum, but we had a panel of petroleum engineers talking about drilling in hazardous environments, the issues they face, the solutions they're working towards. But during the Q&A, one of our participants raised his hand and said, hey, you know what? I'm a dentist. I do a lot of drilling in hazardous environments myself. Have you considered this? And it's an extreme example, but it underscores the kind of dialogues that we need to have in order to solve all these issues that are facing us as a globe. So it's very interdisciplinary, it's very international, it is participant driven. I am not a technical expert, but each plenary session is co-chaired by one African researcher and one US researcher who know what their country's needs, where things are in that field, and who to choose who can best exemplify the frontiers of that field. As a program, we also offer some capacity and development, and we do offer follow-up support, which I'll get to in a couple slides. The first symposium, I'm just throwing in some numbers, but the first one took place in Nairobi in 2022 in partnership with the African Academy of Sciences. Nearly 1,000 applications. There was a lot of interest, but I want to just point out the 5 sessions, which, as you can see, are very distinct and very different. But even from a non-technical perspective, you can see where there are areas of overlap in these sessions. How, I mean, AI can be applied to anything, but how climate change and infectious diseases and biodiversity might all be interlinked, and how perspectives from each of those fields can influence the others. Similarly, we just had our second event in Morocco in January. And again, looking at the session topics, vaccine manufacturing, One Health. If you are in vaccine manufacturing, you know that the manufacturing process, you're working towards that, working towards efficiencies. But if you get someone who knows about human technology interaction and interface, they might have a better understanding of how to make things a little more efficient, things that you wouldn't even consider. And that's no fault of your own. It's just not the field that you're an expert in. So it's important to bring in that expertise from outside. I guess I have some animations. This is just to highlight kind of the diversity. Again, it's not just interdisciplinary, but it's important to bring perspectives from different cultures, different countries, different institutions. So participants from our last event are spread from throughout the US and throughout Africa. And then funding and support. I will say we are looking for kind of the best of the best in their field. We are looking for people who can truly speak to the frontiers of that field. And so the technical bar to attend and participate is very high. I will admit that. We are looking for phenomenal people, but the financial bar is non-existent. We understand not everyone has the same resources, not every institution has the same resources. So if you are selected because of the work you are doing, then we will ensure that you can participate fully without any restrictions. We also provide follow-on funding in the form of travel grants.